Good morning, everyone. Myself, Reann Maria Dominica Nelson from Saveetha College of Physiotherapy, final year BPT. I will be presenting my research on the impact of Theraband exercise versus isometric exercise on rotator cuff strain among boxers. This study was carried out as a part of my final year research project under the guidance of Dr. Pratap Sukindra Babu, Principal of Saveetha College of Physiotherapy. Introduction. The rotator cuff consists of a four group of muscles and tendons that surround the shoulder joint. They play a crucial role in stabilizing the shoulder and allowing smooth movement. The strain happens when these muscles or tendons are overstretched or torn, often due to repetitive overhead activities, trauma, or overuse. In the case of boxers, this injury is extremely common due to continuous and repetitive punching movements, eye shoulder stress during bouts and training, aging and degenerations, poor vascular supply of tendons, overusage of the dominant arm. These factors commonly lead to pain, weakness, and restricted of shoulder functions. Review of literature. Pogorzelski, J. et al. 2021 defined rotator cuff strain as overstretching or tearing of shoulder stabilizing muscles, often caused by repetitive trauma in athletes like boxers, highlighting the importance of early rehabilitation to prevent worsening. Lewis J. et al. 2021 found that interferential therapy (IFT) effectively reduced shoulder pain and improves mobility, making it useful during the early phase of rehabilitation. Nelson G. et al. 2024 concluded that both Theraband and isometric exercise stretchen the rotator cuff without stressing the joint, supporting their role in management of shoulder injuries. Background of the study. Rotator cuff strain is a frequent injury in boxers due to repetitive punching and shoulder overload. It causes pain, reduced mobility, and impact performance. Rehabilitations often include interferential therapy (IFT) for pain and relief strengthening exercises like Theraband and isometric exercises. Need of the study. Boxers are highly prone to rotator cuff strain due to repetitive shoulder movements. While both Theraband and isometric exercise are commonly used in rehab, there is limited comparative research on their effectiveness with paired with interferential therapy (IFT). This study is needed to determine which method offers better pain relief and functional recovery, helping Aim of the study: to evaluate the effects of Theraband and isometric exercise in rotator cuff strain among boxers. Objectives: to assess the effectiveness of Theraband exercise in reducing shoulder pain and improving functions, to determine the role of isometric exercise in managing pain and aiding recovery, to compare both appropriate in combining with IFT for overall functional outcome. Methodology: design comparative study. Subjects: 30 amateur boxers from Jawaharlal Nehru Stadium SDAT Boxing Club. Sampling: convenient sampling was taken. Inclusion criteria: age limit from 18 to 25. Pain during shoulder abduction. Pain during at least 2 of 3 isometric tests. In exclusion criteria: history of shoulder surgery, eye energy trauma, cervical radiculopathy, or severe arthritis. Group allocation and interventions. Participants were divided into two groups. Group A 15 and Group B 15. Group A Theraband with IFT was given. IFT was given for 20 minutes with 18 to 150 Hz. Theraband exercise was shoulder abduction, shoulder extension, and shoulder internal rotation. 10 reps for 2 to 3 sets were given, 3 days a week for 3 weeks. Group B, 15 of them were given isometric exercise combined with IFT. IFT was given with 80 to 150 Hz for 20 minutes. Exercise were isometric shoulder abduction, isometric shoulder external rotation, isometric shoulder internal rotation, and they were performed with 10 to 15 reps for 2 to 3 sets, 3 days a week for 3 weeks. Outcome measures. Two standardized tools were used to measure this progress. Visual analog scale VAS measures subjective pain on a scale from 0 to 10. Disability of arm dash scale was used. A 30 items of questionnaire that was assessed daily functions and physical abilities. Symptoms severity like pain, stiffness, and weakness. These tools these these tools helped in the qualification of pain and disability the before and after the interventions. Results both groups showed improvement, however, the Theraband group showed significant better outcomes. Theraband group A VAS score reduced from 6.87 to 2.53. Dash score reduced from 52.47 to 21.73. Isometric exercise group B VAS score reduced from 7.67 to 3.73. Dash score reduced from 52.47 to 26.7, whereas both interventions were effective. Theraband exercise produced a greater reduction of pain, disabilities, and making them slightly better option when it was paired with IFT. Discussion. The findings align with previous research. Jung et al. 2025 emphasized the importance of scapular stability in boxers with shoulder dysfunctions. Thigpen et al. 2016 showed that resistance band exercise actively key rotator cuff muscles like supraspinatus and infraspinatus, improving shoulder stabilities. Tillin et al. 2012 found that isometric training is effective in maintaining muscle strengthening without stressing the joint. However, the Theraband group had a edge due to dynamic resistance and functional training benefits. Conclusion. Both interventions, Theraband and isometric exercise with IFT, were effective. However, Theraband exercise provided superior outcome in pain reduction and functional improvement. This supports the incorporating Theraband exercise training into rehabilitation protocol for boxers with rotator cuff strain. Reference. These studies support the rationale and outcomes of my project. Thank you.